Okay, my friends, let me draw you back. When we were talking about the mammary glands and the breast, this is a picture that is in your textbook. Everybody know what this is? It's breast cancer. That's breast cancer. So this is what's called a mammogram. Mammary, right? Breasts. Gram, in order to take some sort of picture, right? So they're looking at a picture. This is an X-ray of the breast. That women after the age of 40, most doctors encourage. There's been some discussion over the last 3 or 4 years as to whether mammograms are necessary, because there's a lot of false positives. I would encourage you, ladies, do some research. Read the stuff. Again, you got some years until you have to deal with it. But certainly, if there's a history of breast cancer in your family, they say, yeah, no, you should. Every year you get this done. And you get baseline. Again, the younger you are when you have it done the first time, then you have a baseline. You have what we assume will be a normal mammogram. And then as you age, you can compare and making sure, because again, you're looking for changes. That's what we're dealing with here. I put this in there as well. This is how the reproductive system is interacting with all of the other systems. Some very decent things here, right? Talking about the skin as a sensory role during sexual activity. The bones being a source of calcium. If needed, like if you're not getting enough in your diet, you can leach it from the bones for the milk. The muscular system, the different muscles playing a role in the reproductive process and the sexual activity. The nervous system, again, sensation is a huge part. The endocrine system, the hormones, right? Significant amount of hormonal involvement in the reproductive system to both cause the maturing of the body, right? So to get these secondary sexual characteristics, like, again, in men, the deep voice, the facial hair, the broader shoulders, the thicker waist, the thicker body. In ladies, to get the breast to develop, to get the pubic hair to develop, to get the softness of the skin. These are all things, the widening of the hips. These are your secondary sexual characteristics. Primary sexual characteristic is you can now produce an egg, or you can now produce a sperm. Does that make sense? Because, of course, that's the primary function, egg, sperm. Continuing on, cardiovascular system, pumping blood, right? Certainly for the erectile tissue, it relies on the blood in order to receive, in order to engorge and become erected. So therefore, you need that cardiovascular system working. The lymphatic system is certainly keeping bacteria from entering the reproductive system's pathways, the urethra, the vagina. The digestive system, well, you need nutrition in order to be able to make these eggs and sperm. One of the reasons ladies would stop having their period is if they aren't getting the right nutrients, the right food. Are you with me? This is one, this amenorrhea, where you stop having your period, can be because you are malnourished. And so the body can't afford, it has to use all those nutrients to keep itself alive rather than producing more offspring. Does that make sense? The respiratory system, you certainly need the ATP that is made with the oxygen you breathe in order to perform the sexual activity as well as to produce the egg and the sperm. And last but not least, the urinary system, well, they share tubes, like they share anatomy together, right? That's a big part. And then the fluid loss from the reproductive system, because again, if you are producing semen, that does take fluid. If you are having a baby, there is fluid loss with that, or even nurturing a baby. So dealing with that as well. Here it says breathing. Breathing provides oxygen that assists in the ATP development for eggs and for sperms. Pretty straightforward. I didn't feel like we need to spend much time here. You should be pretty comfortable with how all these systems are working at this point. Questions there? Good. Let's talk about STDs. Isn't that exciting? So I have two slides that aren't in your PowerPoints. I'll put these up on Schoology for you to see. But as I was thinking about this over the course of the last couple of days and doing a little bit of preparation and research, there's two slides here that kind of caught my attention. This really intrigued me. You may be able to see it better if you come closer to it or when you see it on the computer. But this is a slide that is showing, okay, because understand, if you take out the morality piece, hey, please, yeah. We've already covered, I think, and we will spend even more time discussing the whys, morally whys, about why it's so important to not have sex before marriage. We'll talk more about that. Again, I think you've heard this your whole entire life. But this is something that to me just makes sense. Because one of the things that I know I never have to worry about is getting a sexually transmitted disease. Why? Because I have one partner, and that's it. And I know that she has one partner, and that's it. And so, therefore, if I have one sexual partner, and she has one sexual partner, therefore I'm only ever exposed to one other person's germs. Does that make sense? So what this chart is showing you is that if you have two partners over the course of your time, and your partner has two partners, you're talking about 3 people you'll be exposed to. Does this make sense? Because you're not only exposed to the person that you had sex to, but also the person that they had. You with me? No, because it works out. Because you are one of their partners. Right? But do you see how quickly the numbers increase? Okay? And that was just what blew me away. And this stops at 12. And there are certainly a whole group of folk out there who have way more than 12 sexual interactions, right? I mean, for goodness sakes, there are apps where you swipe left or swipe right? And you're not looking for long-term commitments. You're looking just to hang out for a night, right? Does this make sense? So I am not... if you want to read all about all the different sexually transmitted diseases and see all the terrible, gross pictures, and I don't do that. I think it's kind of goofy, to be honest with you, because I'm not trying to scare you. But I am trying to open your eyes that, hey, decisions have consequences, right? And that decision to have a sexual partner, you are sleeping with all the people they've slept with. Does that make sense? The other piece I want to show you, again, that's not on the study guide, is this piece from the CDC. Because folk your age, and even up to age 24, that's what this is dealing with, you are really at the most risk for sexually transmitted diseases, for a number of various reasons this talks about. So you are only 27% of the sexually active population, but you account for 50% of new sexually transmitted infections in a year. New infections. Yes. Okay? And ladies especially, undiagnosed STIs are cause for 24,000 women to become infertile every year. So this is one of the consequences. Obviously, it's an extreme consequence. You guys are good back there? All right. This is one of the extreme consequences. So again, I'm not trying to scare you that, oh, if you have sex one time, you're going to get an STI and you'll become infertile and can't have children. That's not what I'm saying. But it is a risk, right? And then again, as an adult, making an adult decision, you have to understand the risks. As I continue to scroll down here, they're talking about specific types of sexually transmitted infections. And the percentage, again, these are the new infections, that gonorrhea, 70% of folks who get gonorrhea, of the 820,000 people who were infected, does that number not sound humongous? Almost 1 million people, right? 70% of those are folks 15 to 24, right? And you keep moving down. You are affected more. And many of them don't even know, because some of these don't have obvious symptoms. There aren't necessarily, You don't have to have the pain or the discharge or the sores that come. It can be fairly low-key, like they don't look like they have a problem. But yet you still may become infected from them, and then you may receive different effects from this disease. Does this make sense?
So if they have the disease and don't have any effects, then
It might affect you differently. Does that make sense? Because you and I can get the same infection, and you can have one set of symptoms and I can have another set of symptoms. You can get it where it hardly affects you at all. Maybe your immune system for some reason attacks that really easily, but mine it overwhelms, and I become infertile from it. Some other risk factors that are unique to you folks. How many of you, and you don't have to answer if you don't want to, but I'm just kind of curious. This year, how many of you have had a physical? Okay. Because you had to? Okay, for sports, right? That's what gets most of you guys at this point. But understand, as you move older, into the college age, let's say, no one is saying to you, hey, Mikey, come on, let's go get a physical. You know? You have to make that decision to do it. And so often, maybe you don't have insurance, right? Maybe you're just out of school, your parents' insurance doesn't cover you anymore, but you haven't really started a job yet that will pay for you to go to the doctor. You with me? So there's a lot of different reasons why you all are more likely to get STIs than others.
Wait, so how do guys get those diseases? Because there's nothing going into us.
Well, but you are putting, and again, we'll use vaginal sex. You are putting your penis into the vagina, and the fluids are getting into your urethra. There's still contact. 1 second. All right, let's continue. So, there are 3 big things. Number 1, get tested to make sure you don't have any. Okay. Yeah, you can ask to be tested for different pieces. Yes. The vaccination, again, I would say that probably a larger majority of you, the longer I've been teaching now, it used to be I had to, folks didn't even know what HPV was. But now many of you already have the injections or have had the vaccination for that, which again is a very solid thing to do. It's a couple, I think 2 shots that you get over a series of time that helps prevent cervical cancer for ladies or prostate cancer for guys. And also, again, prevents this infection of the HPV virus. It's usually not. Usually this is only sexual fluids or blood, but usually sharing blood consistently. The vaccine? So it's preventing the virus from attacking those cells. And when it attacks those cells, it tends to want to mutate them in a way that they become cancerous. So it's just protecting. It's protecting against that. And then, of course, reducing risk behaviors. Well, what's a risk behavior to getting STDs? Having multiple partners, right? Having unprotected sex, not using a condom or using other things that are preventing the actual transfer of these fluids. Does this make sense? Okay, yes, ma'am. And not so many partners. Yeah, yeah, yeah. Oops, that's not what I want yet. I'm looking for your study guide. Because there were a couple of there we go. There were a couple of STIs I wanted you to be familiar with. If you are in your textbook, can I steal this for a quick second? Because I forgot mine. In your textbook, they deal with the sexually transmitted infections. And By the way, STI is the preferred instead of STDs. It's not a disease. It's just an infection. This starts on page 543. And like that's it. It's 543. So they have a list of symptoms that are present there. What kind of symptoms are they? Burning sensation during urination. What else? I'm looking for the list, honestly. Pain in the lower abdomen. What else? Fever, right? Or swollen glands. Discharge from the vagina or the penis. What else? Pain, itching, or inflammation in the genital or anal area. Pain during intercourse. 2 more. Itchy, runny eyes, blisters, bumps, or any rash on the body. Right. So, are you comfortable? That's a whole wide variety of symptoms. Right? I've got itchy and runny eyes. I must have an STD. No. Okay, no. It could just be allergies. Okay? You realize that's why doctors get paid as much as they do. Shh, stay with me. Because you have multiple things that can give you these. It's called differential diagnosing. Okay, you have these symptoms. What could cause that? Okay, let's test you for allergies. Oh, let's test you for this. Does that make sense? So just because you have pain in the lower part of your abdomen doesn't mean you're going to die of gonorrhea. Okay? But it could be a symptom. Does that make sense? In other words, the obvious ones, like, again, pain during intercourse and discharge or sores, these are what people think of when you think of STIs. But that's only a couple of the symptoms. Does that make sense? That's why I wanted you to be comfortable with that list of symptoms. So let's talk about the different pieces. Pelvic inflammatory disease. And I apologize, I got to steal this from you because I don't have my book here with me. Oh yeah, no, I can do it. So the pelvic inflammatory disease is basically where you have bacteria that enters the vagina for ladies. Those guys don't have it, right? So this is not really something that, well, I suppose you could have an inflammation that enters through a hole like in the digestive system, like a tear in the wall somewhere. But for the most part, pelvic inflammatory disease is a female disease. And it starts an infection in those reproductive organs, okay, in the uterus, in the ovaries. It can lead to scarring and the inability to have children, to infertility. Josh, you had a question? Quickly. Obviously, with antibiotics, you can slow down this infection, but certainly something that wants to be treated. Acquired immunity deficiency syndrome. You know that as what? AIDS, right? AIDS is the disease that comes from HIV, right? The human immunodeficiency virus. What HIV does is it attacks the immune system, in particular the T cells. Remember, going back in the day? It particularly affects the T cells. And so it prevents your body from fighting infection. So you don't die from HIV. You don't die from AIDS. You die from some other infection that your body can't fight off. Like the cold can kill you. The flu. Tuberculosis. There's a whole series of things. Can you live for many, many years with HIV? Absolutely. Certainly now, over the last 20 years, we've had significant improvements in treatments for HIV. Yes?
Can you be like born like with the infection?
You can. If your mother had HIV, and if...
Or like any other disease? Or...
normally not for... I shouldn't say that. Again, if you're passing through the vagina, and the mother has gonorrhea or syphilis or one of these other pieces, sure, the baby can catch that infection. Just like a guy having sex with that woman, because you're going through the same parts of the body, same fluids. There is a lot of fluid exchange, birth, and we'll talk more about this in the next unit, but it's not a pleasant, happy, oh, everything's so cute and nice. No, it's traumatic. So yeah, there's certainly exchange there. It's a great question. I don't think so, but I don't know the answer to that. We have to look it up. If somebody pops that in quick, let us know. Are you with me, my friends? Excuse me. Straightforward how to prevent STIs, right? Don't have sex, duh, easy. If you decide to, you certainly are using a protective mechanism that will prevent the exchange of fluids, right? So we're talking about condoms is one of the better ways of taking care of that. Because just a spermicide, that's not going to prevent you from exchanging fluids, right? Just using a diaphragm over the cervix, right? That's not going to prevent the fluid exchange. You may not get pregnant, right? Birth control pills, do they prevent you from getting STDs? No, they're not stopping that fluid exchange. Does that make sense? That's the key part. Questions there? Yes, ma'am.
It's not a question, it's the breast milk.
Please.
It says the actual risk of transmission of HIV through breast milk is unknown. It is thought to be more likely if a mother is newly infected with primary infection and may therefore be more infectious. Women who are less viremic,
Right, so they have less virus in their bodies.
are less likely to transmit HIV through breast milk.
Okay. So their point is, if you are newly infected, so there are a lot of viruses in your body, and your body is the first time trying to fight against it, then you probably are more likely to pass it on. They'd probably recommend you use formula. But if you are later in the case, I don't know, I would imagine they might even recommend you to use formula regardless, simply because the risk is still possible. Good, thanks for looking that up. Right, that would be a difficult piece. That would be a difficult piece. Yeah, because that could be passed along to the baby, depending on what part is infected and whether it gets into the bloodstream or not. Yeah, could be a difficulty. On the bottom of page 543, there's this whole chart there, table 19.4. I might have that here. Let's see. Yeah, here we go. Table 19.4. That gives you the different diseases, that gives you some symptoms of them. Notice for the most part, antibiotics, if it's a bacteria. For viruses, we have some antiviral drugs, but truthfully we don't have much that works. Viruses you kind of got to deal with. That's why when you go to the doctor with a cold, right, and they'll test to see, oh, is it strep, is it this? And if not, they won't give you antibiotics, right? Because the antibiotics don't actually affect a virus. Questions here? And again, I take the tract with this as I think you should be aware. I think you should know. I'm not trying to scare you by putting a bunch of gross-looking penises and vaginas up on the board that shows all the... Because it's disgusting, to be honest, the end results of some of these diseases. But I think that if you'd like to seek that out, there is the Google. You can certainly find it. Other questions here? STIs before we move on. We're good? Okay. If you were following along with our study guide, we have pretty much rolled our way through this. We will spend a little bit more time talking about the female hormones, because we kind of rolled through that fairly quickly. But we have basically covered the pieces you need to be comfortable with for our assessment, which is next Friday, right? It is Friday. It's not Thursday. It is Friday. Okay. We've got about 10 minutes. I'm thinking. We can start a couple of these. I got a number of very good questions from you guys. And I will post up the whole list of the questions with the answers. I just haven't finished it yet. So I've got a couple of pages worth that I have finished. Once I do that, I'll post them up, and that way you can see it. So let me zoom in here so you don't spend all your time reading all the stuff to come. Whew, that's close. There we go. So one of the questions, I think we've talked about this a bit, but what's the difference between how fraternal twins are formed versus identical twins versus a single baby? So consistently every month, one egg is released, right? If more than one egg are released, which does happen to some ladies, and both of those eggs get fertilized and start growing as a baby, that would be fraternal twins. So they are two separate people. Their DNAs are different, just like you and your brother or you and your sister, right? You are different people from the same parents. You just happen to have the same birthday. Does that make sense? Yes. Yes. So normally multiple births, like more than 2 or 3 at a time, came from in vitro fertilization, where they will take a bunch of eggs, sometimes 10, 12 eggs, fertilize them and implant them all, hoping that 1 or 2 of them will take. And sometimes 5 or 6 or 7 take. Yeah, I don't know the history of them personally, but normally when you're above 3, maybe 4, it was some sort of in vitro fertilization. So the other one would just pass out. Not like fall down, but pass out of the body, just like normal. Yeah.
Is that like a normal thing?
Yeah, I mean, every month that you all have a period, at some point before then, the egg has passed out. And you just is passed out of your system or has been reabsorbed. But the most part, yeah, just discharge. There's always little bits of discharge that is on a consistent basis for ladies. And one time there it was. You guys all right? All right, good. Right, because remember, you ovulate at day 14. So usually within the first 3-4 days, that's about how long it takes the egg to journey from the ovary down through the uterine tubes, out the uterus, out the vagina. So yeah, no, your period is not flushing the egg out. The egg usually has been moved before then. The period is flushing the lining of the uterus. All that stuff it had built up to prepare for that fertilized egg to implant. It's getting rid of that.
Are identical twins always the same sex?
Yeah, so the first part of your question about identical twins we didn't talk about. So identical twins are, here's one egg fertilized, and that egg at some point before it implants splits. And that's a genetic thing. You get mothers who are more prone to have twins that can do this. So those will always be the same sex because, again, it was one egg and now it's become another. So it couldn't possibly go from a male to a female, right? Because genetically it's already been chosen there with 2 X's or an X and a Y. Fraternal twins could be either. It doesn't have to be a boy or a girl. It can be 2 girls, can be 2 boys. Yeah, it just depends.
Wait, so for identical twins, when does it split?
It can be any time. It takes a couple of days worth of time for the egg to travel from what usually it's fertilized in the uterine tube for it to travel down and implant in the uterus. It's usually a couple of days. Any time in that.
How does it have enough contact?
It just simply goes through this mitosis where it's simply totally replicating itself and splitting into 2 complete identical cells. It's not cutting in half because you still have full genetic material in both pieces. So it's not meiosis where it splits to 23s. It's identical. Yes? Shh. Say again? Yeah. So day 1 is the period, the day your period starts. That's how they number it. That the beginning of menses is day 1. And then about 14 days after that, and again, this is all approximation. This is assuming a 28-day cycle. Then day 14 is ovulation.
So with period cramps, is that like uterine contractions pushing out?
It literally is. Yes. They think, she asked about the cramps that come during your period. And that is, yes, it's the uterus itself contracting to try and prevent the significant loss of blood. I mean, because your uterus is bleeding, right? So yeah. Yeah. Apparently you have the same kind of thing after pregnancy. Like after you've given birth, there's a period of a couple of days where these cramps are going because the uterus is now shrinking back to its normal size. And my wife said that was, sorry, yes, sorry, I didn't mean to blow that for you. But yeah, she hated that more than just about anything else. Yeah. Yes, shh. I'm going to stop here with this, but yes, well, I'll keep answering your question.